So, good morning, everyone. Welcome to this roundtable session co-organized by Sciensano, PHIRI, EUPHA's Public Health Monitoring and Reporting section, and EUPHA's Public Health Epidemiology section. So this roundtable will give you insights on the change in demand and consumption of health information. It is supported by EUPHA and co-funded by the European Union. As we want to make this an interactive roundtable and involve you, we invite you to use and abuse of the Q&A and the Slido. The link is in the chat. We will try to answer all of the questions, either live or in writing, because all participants will stay and be muted. The webinar itself is being recorded and will be shared on the EUPHA resources module on our website. Let me now introduce you to the chairs. Petroni Bogart is project researcher and head of the EU Health Information System unit at Sciensano. She's coordinating the Population Health Information Research Infrastructure, PHIRI. She is also leading several activities in the joint actions toward the European Health Data Space, PEDAS, and the Healthy Cloud. She is also president of the EUPHA section on Public Health Monitoring and Reporting. Welcome, Petroni. And Nedel Kalea is director of the Department of Health Information and Research at the Ministry of Health of Malta and head of Department of the Public Health at the University of Malta. He has been part of the senior advisory and the transition strategy group of the Malta COVID-19 response team. Welcome, Neville, and over to you, Petroni.
Thank you so much. So welcome, everyone. Thank you for attending this workshop on the change in demand and consumption of health information. So indeed, my name is Petronel, and I'll be very happy to chair this session together with Neville. But before we start, we wanted to have a bit of an icebreaker because many people are still joining, and it's a good way of having people a bit interact already before we start. So what we are planning is to have a Slido. So you will have the Slido link also in the chat, or you can use your cell phone to scan the QR code. And our first question is just to see who we have around the table. So we would like to know which country you come from. And of course, if it's not a country specific, you can also say Europe or any other region. But it would be really lovely to see who all across Europe or the globe, maybe, who knows, is following up on this session. So this will help us to frame a little bit all these different areas that we will bring together today. So I see there is a good distribution already. People are still joining in the Slido, so don't hesitate to screen the QR code, which is on your left side. And yes, oh great, I see we have people from Africa and from Morocco as well joining. This is excellent, really happy. Also, towards the end of, throughout the whole session, we are really keen on getting your questions, which we will then put forward to our panel. So don't hesitate at any time if you have any questions that come up or any thoughts or comments. This is also supposed to be a place where you could share your thoughts on what is being presented. Feel free to do that, so in Slido or in the chat of the actual meeting. So that would be great. Then we have a second question. We also want to see what kind of organization you represent. So whether you are coming from a public health institute, a university, maybe from private company or from hospitals, we'd be really keen on seeing which organization you represent. Yeah, and that helps us to also know who is around the table for today. Thank you. So what do we see? Lots of public health institutes, also universities, that's great. Also some other sections from EUPHA that are here. Great, it's good to see you as well. The observatory, so other academics as well. Health directorate, so I suppose this Ministry of Health joining us here as well. Then a health payer. That's great to also see you here. And let's just wait a couple more minutes if some more are coming in. All right. I think we have 27 answers. That's already quite a nice group. So health communication, oh, that's excellent. We have a lot to learn from you as well. And EUPHA Law is here as well, EUPHA HTA as well, that's great. So we also see some other EUPHA sections being represented. Okay, I think we can move on. Neville, are you with us now? Yes, I see Neville. Okay, great. If you can unmute yourself, and then I give you the floor to set the scene. Thank you.
Yes, so hi, welcome everyone, and thanks for finding the time to join us. So as you probably have seen a bit from the abstract, potentially, we have most of us here, at least in the panel, have been involved in the production or dissemination of health information for several years. And we have never, probably none of us, has ever experienced a situation like the past 3 years in terms of demand for health information and pressures. So health information typically is one of those areas of public health which attracts maybe little attention, really. Most of public health attracts little attention in normal peace time, if we can call it so. But at one point, we ended up with lots of pressure to deliver data in real time, effectively, when traditionally health information producers always, wanted to sort of make sure to validate the data before publishing. So there was always a bit of a lag time. Okay, so within health information production, attention to detail and accuracy is quite a priority typically. So this became a bit of a conflict, right, in terms of timeliness versus accuracy. So that was one challenge. We also ended up being questioned, right? So our expertise has been questioned and challenged as well by not just scientists, not just people with scientific training, but also the man in the street. So the man in the street actually started consuming much more health information than they used to before. So that was another challenge we had to deal with. We also have very interesting prospects coming up in health information, right? I think probably Irene will talk to us a bit about the European health data space and what that presents in terms of challenges and opportunities. And we'd like basically to use this session to reflect on what has happened and have we been successful maybe in cementing our role in public health, or have we actually been worked around and sidelined in some situations? And always with an eye to the future. Okay, so where is this taking us? Where should we head from here? What opportunities should we take up? Again, this limelight that health information has got over the past 3 years. It would be a pity to just let it wane and disappear like everything else COVID related. What should we retain and make sure that we keep nurturing for the future? And I think that's really the background that we're seeing for this session. I'm not sure if maybe Petronil would like to add anything to that, but that was roughly what we're trying to achieve with this session, also with your participation. So this is not a one-way channel, but we'd really love to see what you have to add to this discussion. Thank you.
Thank you so much, Neville. Maybe what would also be nice to add is what we mean with health information. And
yes, correct.
So health information for us is not just solely data, but it's everything in health information that can be provided. So it also includes the data that is being translated, analyzed, used, and the reports that come out of that. So when we think, for example, of a health information, it's everything from the moment the data is being collected, how it's being processed, how it's then being used, and then how it's fed back into the system, and all the resources that you need to be able to support health information to flow well as a system within countries and across countries.
Indeed, indeed. What we mean usually by health information is the whole process from the actual capture to the point where it's used and implemented in policy or any other decision-making that needs to happen. So anything that happens in between, and for a variety of users as well, be it policymaker, be it researcher, be it general public, who is simply trying to improve one's well-being. So thanks, Katrina, for that. Yes, indeed.
Great. So thank you, Neville, for really putting the frame and the reason why we wanted also to organize this workshop. So we have 3 speakers lined up for you today, all of which will be representing a slightly different perspective to health information users across the system. So our first speaker I will introduce is Elena Petelos. She is lecturer in evidence-based medicine and evidence-informed policy and senior research fellow in public health at the University of Crete and Maastricht University. She's also a member of the advisory forum of the European Commission's Health Emergency Preparedness and Response Authority, and she will be representing for us today the policy-making perspective. Thank you, Elena, for being here. Then we have Guzda Susuzulu. She's project coordinator of the European Patients Forum, Data Saves Lives initiative, which aims at raising wider patient and public awareness about the importance of health data, exploring societal questions about the uses of health data, and supporting stakeholder dialogue, with a view to enhancing trust, cooperation, and good practices. So she will be representing the patients and citizens' perspective. Welcome, Gusta.
Thank you. Thank you for inviting me today.
And then we have Irini Kesisoglu. She is researcher and project manager at the EU Health Information System unit at Sciensano, and she is responsible for various European projects. She's task leader in, for example, the health data at EU pilot project, which sets the stage for the European health data space by piloting several activities. She also is participating in a joint action towards the European health data space and leading several tasks in the Healthy Cloud project. So she will be representing the researcher's perspective with her experience of the European health data space. So as well, in that sense, the future perspective. Thank you for being here, Irini.
Thank you very much for inviting me.
And then I pass the floor to Neville, who will go and over our first question for the panelists. Thank you.
Thanks, Petronil. Indeed. The first question we'd like to ask you, and probably I'll turn to Elena first. So in terms of consumption of health information, in your experience, how has the consumption of health information changed from pre-pandemic through the pandemic to today? And would really appreciate, from your perspective, from the stakeholder, from the perspective of the stakeholder you're representing, what you have observed during this time. Elena.
Thanks for the very interesting question. As you know, there's a link. I mean, health data, the output of research, particularly translational or population health research, and the link to evidence, what constitutes evidence and what becomes from evidence feeding back to policymakers, the audience, and practitioners communicated information again, is an inextricably strong link. So there has always been demand for health information to be relevant, timely, and simple. And pretty much as for other, let us say, products, demand has been unprecedented and consumption has been unprecedented, with all the challenges this poses, because for health information, the answers that policymakers required were now, and for critical questions, very often we did not have the necessary health information, or a particularly challenging topic and process was to get policymakers and particularly in terms of informing agendas and of course broader audiences to comprehend that it is not a static thing. Health information is continuously evolving as data comes along, and that you can only have quality data and robust evidence to communicate and to generate health information with very good infrastructures, which sadly, I'm sorry to say, to some extent, we are still very much lacking. I don't want to go into very lengthy examples, but one which is very well recorded and extends well beyond COVID before and will continue after is the continuous need to consume and to develop, let us say, easy to digest information for the public and for policymakers alike, for vaccines, because for the key questions, we do not have the evidence and the data we require. And then, of course, as you know, the emerging themes in this consumption was, if you like, if you make the analogy, if you allow me the analogy, we had bad diets of misinformation and disinformation. So we have, and bad even, and a concept for public health, we are very much involved with labeling of products, but you cannot really label information very soundly. So the people in their diets and the policymakers in the diets were exposed to, let us say, sources of health information that would not necessarily be very robust. And we are seeing, same as when you have a bad diet, you have after effects. We are still seeing this, and it will be a challenge to see how we address in the future. What is currently, I think, concerning all of us is the fact that we need to increase preparedness for all types of public health threats. We are already seeing different topics emerging, like shortages. And an aspect which is less explored is the fact that different types of sources, different disciplines, and different types of cross-sectoral collaboration is needed to generate health information. So what is health information or relevant to generate health information is not confined to the health sector domain, if you like, or to health data. So we need to pull out different types of data to make the health information relevant, easy to consume, and aligned between different audiences which have a need for very different diets, very different type of food to consume. And for public health practitioners alike, I think it's a very big continuously stepwise care for us, because we have to come together to have strategic approaches in addressing something that will be continuously ever-changing, not least because of the media via which health information is being consumed. So we're not talking books or booklets, we're talking digital tools, we're talking other issues emerging in terms of security and in terms of ensuring that the sources are reliable, and different types of training and literacy, if you like, for both everyone, policymakers, public audiences, and practitioners, specialists, and so on. Thanks.
Thank you, Elena. As we can see, never a dull moment for the policymakers, and it's continually evolving, the topic of the conversation. I'm going to turn to Gosde, if you allow me, on a first name basis. Gosde, we never met before this meeting. I'm really happy to meet you. Before, however, giving you the floor, I'd like to announce something small to our participants. So if your Slido is still open, you will notice that the question has changed. What we're trying to capture from are any keywords that appeal to you from the discussion that we're having. We'd like them to sort of do a bit of a recollection then at the end of this session before going to the Q&A, to also help us then provoke the discussion before the end of this webinar. So, Gosde, I turn to you. I'm not sure if you remember the question. So how has the consumption of health information changed for you? On behalf of the patients.
Great, thank you, and it's very nice to meet you too, Neville. So for me, I think, Elena, I will more or less echo, because I mean, we're on the same train here. Since COVID-19, everybody jumped on the same train. Wagons moving kind of analogy maybe I could make as well. So one of the key things we realized with COVID-19 is it's exposed the already existing lack of capacity of healthcare systems, and for them to provide, you know, this timely access to diagnosis and care. So this kind of sparked the thirst that was already there, especially in the patient communities. Now it's stretched to the citizens as well, because everybody got impacted and we all became patients. So health information only highlights the need for the patient organizations for them to be involved in the creation of a system, because we need a system for this health information to be communicated, the processes should be out there, and for them to be clear and transparent, and for them to work actually and kind of modular, to be modified based on the needs of a nation. So not, because as we always say, EU is not one country. So it's very important for it to be modular. So one system that is modular, that as the patients from the beginning in the development of it, it's easier said than done. We know it. So what we are realizing more and more is patients since the beginning were hungry for all the information they can get about their disease area, the clinical work that's behind it, what is in it for me for the future, you know, how can I kind of be part of this whole process so that it improves my life, but my next generation, so that it's like it was really already a big community even before COVID-19. But with COVID-19, actually, patients are kind of being taken advantage of this opportunity of the rest of the society being awakened with the needs and the developments, and they need to be done fast. So in that sense, what we realized as EPF, the European Patients Forum, discussing with our members, we realized the big need for education. You cannot have a meaningful involvement of patients, let alone society citizens, without them really understanding what they are participating at, or what they are, which process are they in, and who are those stakeholders and what are they talking about. So in that sense, COVID-19 helped us a lot to kind of move faster. But of course, we will talk about that maybe separately. Is it a better thing to move that fast? What did we leave behind? But in the sense that the less we leave behind, the better. For that, education is very important and training is very important. I will maybe mention about data saves lives in that context as well, because we're really working hard. We just started, and it's very important for us, the meaningful involvement of the patient communities, at least to start with. And then the citizens will actually be created this trust, things with the channeling of the patient and patient organizations in the local settings.
Indeed, thank you so much. I think the concept of the patient as a partner in the healthcare process clearly applies also to health information and data consumption. Thank you for that. I'm going to turn to our last panelist, but not least, of course, Irini.
Yeah, thank you, Nero. So as answering your question a bit from the researcher perspective in this aspect, and also a project manager of the European Health Data Space. So before the pandemic, pre-pandemic, researchers, of course, were always consuming health information and health data, but it's true that there wasn't really a centralized infrastructure or a centralized portal where researchers could go in and find where the data is and consume it. So mostly what was happening is that researchers gathered data from within their institute, within the university where they work in, or within the hospitals that they collaborate with. And if they are in European projects, then in European consortia, they would go towards their partners in this European project and get information from there. That's what was happening before the pandemic. However, during the pandemic, as you all mentioned, there was an increased thirst of having more information and faster. The problem is that science, proper research, is not done fast. Good science needs time. And apart from that, there was a big lack in knowing and communicating where is what data and how do I access this data and how do I know even within my country who is collecting what. So that was a big issue, wanting a lot of data much faster but without knowing where it is. So that's what was happening during the pandemic. And I think that now, post-pandemic, or still there, but okay, we are understanding the need, first of all, at the European level. I think member states, although before the pandemic, health was very much national competency, now more and more member states understand that there's a need for collaboration between member states in Europe on health. So they opened up to the discussion on the European health data space legislation, collaborating, sharing health data for secondary use in Europe starts being really important to everyone. Because like that, you know not only where the data is, but you can have access in a regulated, structured format to this data as a researcher. So, yeah.
Okay. Thanks, Irini. Yeah, so that brings us to the end of our panel for the first question, but I think Petronell has another question for you.
Yeah, so now we've understood a bit better in terms of consumption, but now we want to see what does that mean in terms of supply. So how the supply of health information change to meet these new demands during the pandemic. And especially, I think what we're really interested in hearing is how should we then maintain this? So there has been a big surge in terms of what we want to consume, in terms of health information, in knowledge that we want to have to be able to make better decisions for policymakers, to be able for researchers to do their research, and for patients to be able to improve the health of the population. So what, according to you, needs to be done, and are we ready for it? We heard saying that things have gone a lot faster. Is this a pace that we can keep in the future? And what do you think, will be really key? So what needs to be done, and are we ready for it? Elena?
Thanks for the question. I mean, in some ways, I started touching on supply and generating evidence and information in the first question. To start responding in reverse order, I think it would maintain, it would even be accelerated, not necessarily because we will make an effort to make it so, but because we have new tools and the technology goes extremely faster. Having said that, and also being involved in this in different hats, because I am at EUPHA, the Vice President for HTA, but I'm also co-chairing the RWE and Artificial Intelligence section at HCAI. New challenges emerged from this type of usage and processing, if you like. So we have a lot of ethical and legal issues arising across the spectrum, if you like, of the life cycle of the information or the data. We have to be very careful or very mindful of how information is collected and processed. And we're discussing ethics by design, but we have a lot of black box issues to consider. Mm-hmm. And of course, this is something in which the public has also, if you like, reacted, because in principle, we have seen that people, and there is already sufficient evidence and reported evidence and research to show that people are very willing to share the data, not only for their individual well-being and good, but for the broader societal good too. And this is expressed in different ways, in willingness to share data and willingness to participate in trials and so on. I think probably our colleague from EPF can say more about the willingness of patients really to do this. But the legislative framework and the regulatory framework have not moved fast enough to provide a robust safeguards and to clarify what the secondary use of data potentially means in terms of how we do this processing and generate information. And we have new concepts which come from different disciplines or even within the health sector and research, have different, if you like, guises and interpretations, from anonymization to pseudonymization to security. Right. And this presents a challenge in terms of the workforce working in these topics. So the main challenge would be to continue having people that are trained in a disciplinary manner. So yeah, hope this helps.
Yeah, I think we mentioned three main, or you mentioned three main elements. So new tools, new concepts, and a lacking legal framework. So I think there's a lot of interesting evolutions now going on. Maybe I'll jump to Irini first, and then I'll go to you, Costa. So since the one of the elements you mentioned is legal framework, what are your views on that, Irini?
Yeah, so, well, regarding the legal framework, first of all, is actually also the new tools. Basically, during the pandemic, everyone started sharing information a bit more openly, but aggregated on an aggregated level, because we were in a crisis situation and we had to share information fast. So of course, this is not sustainable and it's not really the proper way to do it. And that's why having the European Health Data Space legislation coming up is something that will facilitate and will also regulate and structure the way that health data is shared across Europe, making sure that the safeguards are there, data privacy is not affected, but also making sure that it's facilitated so that this sharing of health data is happening and in a structured way. So one aspect that the European Health Data Space legislation for secondary use. So when we say secondary use, first of all, I want to clarify that it's for any use of health data or information for any other purpose than the one that they were initially collected for. So that could be either research, policy making, or another purpose. So what the legislation focuses on secondary use is to, first of all, make health data findable. So as I said also before, having these sort of catalogs where, or a common portal where anyone can go and see what data is available, where is it, and how do I get access to it. Then they also focus on a standardized accessibility to the data with a standardized access form, and all of these kind of regulated, and also interoperability. Interoperability is very important. So to make sure that all data are structured in the same way. First of all, making sure that every member state has digitalized health information. It's very important, key. Then this digitalized has to be structured using common standards in order for data sets to communicate with each other, in order to be able to link data sets within a member state, but also across member states. This is very important for good research and faster research if we want, and to be prepared for a future crisis. Another aspect that could help also patients is having open data. So we saw a rise of a lot of dashboards during the pandemic that media were looking at. Indeed, having actually a dashboard in a common portal that shows you the studies that are being done with the health data in a user-friendly, in a layman's way is very important for citizens and also for policymakers to have a view of what's going on of the health status in the country.
Okay, thank you, Irini. So yeah, I think also a point made by Elena is really this ethics by design. And of course, this is really important for patients. And in terms of how this consumption has changed. So you talked about previously that the information is moving faster. How can we make sure that we keep this information available if it needs to be faster and faster? So dashboards, you mentioned, Irini, are one way. What are your views, Gözde?
First of all, the key thing I think we all agree is everything got faster. In the information, developments during COVID, it's just like speeded up. The key is the demand increased as well, because we got people used to this. It was working in the sense that we didn't know what was behind the scenes, how untidy it was, how unstructured it was, like Irene said as well, how legally it wasn't that built on solid structures. It was just emergency. But the demand is not getting less, especially from the patient community and the citizens. The demand, once you feed that much information, they would like to keep the same pace. But what is very important for them to understand is the lift the curtain up. So what is behind all the, what are the advantages of actually now slowing down and making a structure around it, making a legal framework around it, make it interoperable, for example, like Irene said, making sure that fast was good during this pandemic period, but it is not good in the long run. It needs to kind of slow down now, go backwards a little bit, and then make something that's sustainable in the long run. For that, we need to kind of get the patients and the citizens. That's why I'm going back again to this Data Saves Lives initiative we're doing. The European Health Data Space needs to run parallel with initiatives, at least one actually overarching initiative like that, or a solution, a project that will be also on the local settings, can communicate to the public, and like we did it during COVID, kind of step by step walk people through what's going on, so that people trust comes by knowing, and transparency. And for that, it really has to be reaching to the real people with the right message. And I mean, policymakers are not communications officers, right? Or researchers or healthcare professionals. I mean, that's another speciality, another expertise that needs to be settled in any national or a local setting if you want to have an uptake of any solution that will be introduced coming after COVID, because we need more than just, fast, but also accurate and sustainable.
Yeah, thank you. And this really nicely brings us to the next topic of this discussion, which is trust. But before that, let me pass the floor to Elena, because she still has a comment to make. Over to you.
Just in one sentence, when we say legal framework, having legislation doesn't mean implementation. Law is about implementation, but even for GDPR, it's there. It's yet to be properly implemented and interpreted across member states. So when we say that we need legislation also to respond to Irene's point, we're very, very far away from actually having implementable and actionable frames. That's all for me. And of course, this probably has implications also in terms of the discussion with policymakers and the commitments they make. So,
Irene, you want to also respond to that?
Yeah, actually, because in the question you also mentioned how prepared we are. And I just wanted to mention one thing from our experience in TEDAS, in the joint action towards the European Health Data Space, where we went to 12 different member states. And what we saw is that indeed, most member states were not prepared, definitely not to implement the European Health Data Space today. However, what is good is that all member states were very keen on working towards it, on starting either on their legislative framework at the national level, or starting from the infrastructure, making sure that data is of high quality and digitalized. So it's, yes, now we're not there, but everyone is on board working on it. So that's good.
Thank you, Irene. So more on that topic of trust, Neville.
Hi, thanks, Petronel. And thanks to all of you. This discussion has nicely morphed into the next question, actually. And I think I've noticed a question coming up in the chat, in the Q&A, which possibly might also be addressed through the next question. But obviously, we can discuss later more on this. So I think the next elephant in the room, so to say, we would like to tackle is the concept of trust. Okay, so as I said earlier, before we sort of had respect for certain authorities, if I can call it so. But now that authority is being challenged, including the authority of whoever is producing that health information, their respectability, etc., etc. So with this extension of the interest in health information to the general public, to an audience which was not consuming health information traditionally, okay, these challenges have come up again. So maybe the health information supply chain has actually, maybe we've been taking trust for granted, but then obviously the infodemic, which I think Elena has alluded to earlier on already, has challenged this trust. How, in your opinion, I think Agostya has already started to some extent answering this question, but how can we nurture and maintain that public trust again in the health information which is produced, supplied, and consumed? Maybe I turn towards Elena first.
So this is a very complex issue. Trust issue is a very complex issue, and also inextricably again linked to different aspects of communication, of literacy, and to broader trust to institutions and what has been done, if you like, at peacetime. So we've seen in settings where there has been trust in practitioners or policymakers, we've seen responses where public and policymakers alike, if you like, were more prone to trust decision making that was informed by the evidence. But having said that, we have seen also cases where the public has and the policymakers have become distrustful, if you like, of the evidence provided, because it tends to have, even if the information and the evidence were accurate, it tends to have some ramifications or implications for their own individual decisions. So we had the ability of making individual decisions on how you go about, for lockdowns, for example, if you like, taking away from people. And I think there's a price to pay for that. Additionally to that, there has also been too much information that was not well-resourced or well-supported, and the public and policymakers are not particularly happy about that because there's a price to pay. I do not know moving forward whether the solution is health literacy. Literacy is a complex concept, and health literacy is one aspect. But to rebuild trust has been eroded progressively more and more. It's linked to other social determinants, economic determinants, so it's a very complex issue to research. But I don't necessarily believe that the only solution is health literacy. There are aspects of digital literacy, there are aspects of joint decision-making, there are aspects of demonstrating you have sound governance in decision-making that have not been adequately examined. So in most cases, making decisions was confined to committees, ad hoc meetings, and so on for critical decisions in the pandemic. And this has backfired in many countries, and it's still being looked upon. And another final word, a concern that I personally have very briefly, is that we all discuss post-COVID lessons, if you like, or lessons from the pandemic, but the public and also decision makers want to move away from that dialogue. So I'm not quite sure where we'll be going in terms of discussing trust issues in lessons learned. Thanks.
Okay, thanks a lot. Indeed, you mentioned health literacy as one potential area where we might wish to go into. I think probably most of us have observed this. We've seen that patients can actually be more of a partner in the process of even production of health information, even though traditionally, with our quest for accuracy of data, maybe we might have dismissed the patient a bit in terms of a source of accurate and useful health information. But I think we've seen that evolve a lot during these 3 years. Gosla, I'm going to turn to you. So what do you see as what would help us actually rebuild that trust and nurture it and maintain it?
I agree with Elena. There are so many different aspects to it, and one of the key things to recognize is we cannot do everything at the same time. We really have to choose our battles and prioritize the things first that need to go, like the pilots, not only about the solutions, but also countries, on the information we choose, the community we address. But we have to start granular, really small steps, because there are a lot of ideas. Trust is one of those as well. Is the more you rush things, there is a higher chance you will lose the trust faster. But there is never a 100% reliable trust environment. It can, because especially around health data, health topics, a very personal topic, you know, this whole thing about people think they own their health data because it's coming from them, but actually it's a process it's a societal, actually, you know, product, that there are so many things that we can lose trust very quickly, even if we build it over the years. What's very important, we've noticed from our members, is transparency. So you cannot only feed good things about, like data saves lives is a nice slogan, but it's too positive. It does save lives, yes, but we always have to also share the but that could happen, which is there is a risk. Yes, there are certain countries or local settings that will not be as trustworthy as maybe the others, but it's important to communicate exactly where you are, what you're doing, and also the risks. It's important for the people to know the risks. So do not underestimate their understanding and knowledge, but then still give them the power to decide what they're going to do with that information. So I think step by step, that's going to be one of the key areas we need to focus, is the media, but also monitoring the media for false information, but also not to let that false information take over the fear and it grows, is to communicate. So there is a lot of work for the politicians, for healthcare services, to actually be transparent, which we see the big challenge within even Europe. It's not easy, but we cannot win every battle. So we have to pick our battles and start from somewhere. And then step by step, I think it's going to be a long process, but eventually we're going to see that system in place. It's just a much longer process than it looks on the paper.
Okay, thank you. Thank you for that. I think I must admit, it does give me a bit of comfort to see that from a patient perspective, accuracy obviously has definitely much more value than speed, because that has always been a bit of a dilemma for the health information producer, trying to keep up the speed that the emergency was requiring. But I can see that that need is not perceived as strongly as it was during the emergency, but rather, I think we're on the same track when we say that we both prioritize accuracy and, yes, agreed, transparency. What fascinates us as well as health information producers, or whatever, health informatics stakeholders, is that there's a different level, different kind of trust in health information systems as opposed to other more common applications such as social media, Google, Facebook, Twitter. We seem to trust these corporate players more with information as a general rule than we would trust the persons in charge of the health information supply chain. And this also is an interesting phenomenon. Like, how does it happen? Why do people trust social media more than they trust their doctor, their Ministry of Health? I'm not sure if you have any reflections on this, Gosda, before moving on to Irini.
Just very quickly, one of the key elements is as well what is in it for me. And I think social media is feeding very well that aspect. It's mesmerizing, it takes over, it's beyond the filter of thinking, is this safe? It's more easy information, just out of the oven, well cooked, and you don't care how much calorie it has in it. Yeah, whereas, yeah, I think it's the value, the what's in it for me. Social media has been feeding that aspect of it quite well.
And
so,
maybe also to add that maybe social media is also better with algorithms at really feeling what people want to hear. Yeah. So it also is tailored to exactly what this person might want to hear.
I will partially disagree, if I may, just, Neville.
Sure.
Google has been there. People have been using it for 10, 15, 20 years. Facebook, the same. How many national health, public health policies have had active interaction through social media platforms or digital means with the public? I mean, we were very late coming in, and in countries where, there's some UK train, and, there was a lot of reaction when trials was being done by NHS, but people actually use a lot and trust a lot the NHS sites for symptoms, triaging, and so on. So it's also familiarity. People are comfortable with things that they know, not with a new initiative that, suddenly arises within the pandemic and so on. And then, of course, something we discuss in infodemic management also, when we're coming together with institutes and countries, face, you know, in the social media, they have people that they know. I don't think they necessarily trust social media more than their personal physician if they really trust him or her. But it's quite different if it's an anonymous, faceless site from the ministry or from a public health institute. So it's also how you package the information. If you make it digestible and appropriate, suitable for consumption, if you make it bite-sized, I mean, it's a challenge, you know, in also the format that you deliver the information. So I think it's partially our fault, if you like. So
thanks for that. So definitely the way we communicate is something maybe we need to work on as well. Irini, what opportunities do you see in the future that could help us improve our trust?
Yeah, actually, along the lines, first, I wanted to mention the fact that most citizens, and we see that a lot with patients, they really want to share their data. It's not that they don't trust, especially patients really want to share their data for research because they want to see a better treatment for their disease. But there are always, what we've been hearing from stakeholders is that citizens and patients want to know where their data was used. So just having a portal where you can see what studies are being done with your data could help in this aspect, you know, in being more involved in the whole process of sharing health information and what is being done with it afterwards. Also, another point is having an opt-in and opt-out method. So opting in to share your data or opting out from having your data being shared. That control, giving that control to citizens is also very important. And then another point I wanted to mention is that, yes, the pandemic has definitely affected public trust. Misinformation, disinformation, or controversial guidelines during the pandemic really impacted public trust because we saw that many people just stopped trusting their government. They didn't know what to follow anymore. However, in other member states, we heard that the public has a lot of high trust to their government, and actually, these countries wanted to make sure that in the European Health Data Space legislation there is enough safeguards to keep the data privacy. So yeah, the landscape is a bit 50-50 at the moment. Some countries have a high trust, and others need to work on it.
Thanks, Irini. Indeed. So that's some nice concluding remarks that come full circle also with the other stakeholders. I'm conscious of time and would really like to give you some space as well. So I'm going to pass the baton back to Petronil. I hope the Slido has been active during these lovely pitches by our expert panelists.
Yes, we also saw some questions in the chat, and I think these have more or less already been answered by the colleagues. Yes, so the question, what is the key word that you take home from today's session? So our colleague will bring up the Slido, so you can also, yes, okay, so we see already some of the answers, but don't hesitate to bring in more. Dialogue, of course, we have mentioned communication on several occasions, and when we have this dialogue, I think what's really key, and which was mentioned by all of the speakers, is really this transparency. And it's not easy to achieve, but yeah, there you go, transparency just popped up. Not easy to achieve, but definitely something we want to work towards do. Need of structured data, quality in terms of speed, so the balance that we have to find between these two. Owning your data, infrastructure, credibility and trust, collaboration, engagement. So yes, I think this nicely brings together the different areas that we have covered. So I think maybe we could go to one last question to our panelists. One overarching question is what do we need to regain this trust and move forward? Maybe just in a couple of, maybe in just one sentence or two sentences, what each of you thinks. So we'll do a quick tour again to our panelists, and then we will close the meeting. So maybe Guzda, would you like to start?
Yes, sure. So regaining trust, maybe that piece also is important. Like Irina said as well, some places didn't lose that trust, or even maybe trusting more to the system, because pandemic actually kind of proved them that they can rely on and trust their own healthcare system and their, you know, governments and their infrastructures. Whereas the ones that lost that trust, I think, as I said, it's not going to be a very quick solution, and there is not one solution fit them all. That's why it's very important to do analysis and understand the needs, and again, the difference between citizens and patients. Probably patient communities have different fragile, sensitive points than the citizens. So it's very important to do homework, you know, like desk study before moving forward with anything fast, and take our steps to figure out what the community, society needs, and then move forward or act on it. And I think bit by bit, it will be gained.
Thank you. That's very clear. Irini.
Yeah, I think that to gain trust, we also have to be strong in the background. So first of all, is building a strong infrastructure, resilient infrastructure. And then once this is built, and then with confidence, we can communicate to the general public what are the safeguards, how data is shared, what are the, communicate and be more transparent in the whole process. But it needs to be, the system needs to be resilient, and the infrastructure needs to be there to have this.
Thank you, Elena.
So starting in reverse, we need transparency in decision making. We had a lot of opaque decision making, mentioned black box as an analogy. I echo Irene, but I'm not as optimistic as you like, because to build robust research infrastructures and infrastructure in general, even for processing electronic health records and merging data across sectors, you need investment. And that is a complex issue at the moment, and these are lean times. And last but certainly not least, I think we touched upon the infodemic a little bit, which is you need to build infodemic capacity to manage this type of information. And this is not, there's a big risk there as tackling this as a communication or branding issue. That is not the case. It's a very complex issue that requires interdisciplinary collaboration and brokering dialogue. We did not use the tools we had to broker dialogue with the public in a transparent matter and to ensure accountability. So we can do more in that aspect too, I think.
All right, so there's work for us to do. I'm passing the floor to Neville. Neville, over to you.
Sure. So we also have another interesting question in the Q&A, but basically, so we have the role of the researcher in the communication of health information. So we've seen research being coming out in preprints, fast. Sometimes researchers might not be the best diplomats, so to say, to communicate certain elements in health information, certain limitations. And that goes haywire. Okay, so it's picked up by anti-vax lobbies, etc., etc. So any comment from any of the speakers on the role and responsibility, potentially, of the researcher in communicating health information?
Well, I think, first of all, the reason why it was going a bit everywhere, it's because, as I said, good peer-reviewed research needs time. Normally, you need at least 6 months to have your article being peer-reviewed, and then another, and then to do the experiments to make sure that you respond to these reviews. This was not being done during the pandemic, and what was happening is that a lot of articles being in bioRxiv, which is an open source where you can find articles that have been submitted but have not been published yet, properly were published. So basically people were picking up on these articles, and this is where the misinformation started. I don't know what a researcher can do for that, other than making sure that once the article is published, that there is also a version that is more communicable and understandable for the general public. Other than that, yes, health data literacy is very important, and literacy in general, making sure that what you're reading, you understand that it's not peer-reviewed. That's also very important to communicate it to the general public. That's not a given.
Maybe to add one comment.
No.
Yeah, peer review is great, but it doesn't necessarily save the day. I mean, we've seen peer-reviewed things that have been not very, if you like, resilient, and there is some confusion in terms of, if you like, the different types of reporting, evidence, and documentation. So papers are nice, but really decision-making, policy, and so on comes from regulatory submissions to agencies mostly, or data that is not necessarily disseminated and communicated to the public. What has happened in the world of clinical trials for patients is having lay summaries, becoming embedded a compulsory item in the legislation. So in lay terms, brief summaries. We don't yet have this for papers, research papers, but I think it could be something to accompany, and for every decision that we make in the public health sector, something to briefly guide the people to the original primary care data. So moving forward, people should be able to filter that, and that is a learning process. So just starting by having lay summaries, going further and beyond trials just on every research paper could be the way forward, and could also be a tool to train younger people. Because the 12-year-olds, I do not know, and the 8-year-olds were consuming also information, had opinion about vaccines, and have opinion about trusting systems. And it's the new generation that is coming in, and we need to prepare for. They decide differently, they process information differently, they consume differently, and they learn differently. So, yeah.
Interesting you mentioned that, Elena. I know of one particular academic journal publishing house that has gone down that route, actually producing a scientific journal for kids, reviewed by kids, and it's fascinating.
It should be, and it has to start there.
Indeed.
It has to.
So, Gosli, I'm not sure if you wanted to add anything to this, or
just one last thing. I know we're running out of time. So in this process, it's very important as well not to create false hopes. This was one of the key things that came out of our members. When we're communicating and making things simpler and easier to understand, if we make it in a way communicated that can give false hopes, especially to patient communities, that is a very dangerous area to move forward. So it's a very sensitive area. But that's all I wanted to add.
Thank you so much, and indeed we are close. Well, we're past time actually, because we promised you to finish at 12. I'm not sure if Petronel would like to add anything before we let Marie intervene on behalf of you.
Well, what I would like to add is I would just like to thank everyone who worked really hard to make this webinar go live. So thank you to our speakers, obviously. Thank you to all the participants. Thank you to EUPHA, and also thank to Barthélemy, who's worked very hard to make this a reality. So passing the floor now to Marie for some final words. Thank you.
So many thanks everyone for joining us today for this roundtable on the change in demand and consumption of health information. I hope you learned a lot. So this roundtable was part of a webinar, EUPHA webinar series related to the European Public Health Conference.